I am going to be using today, let me come down to exercise 3 here. I'm going to be using today this detailed structure tissue walkthrough of connective. This is a PowerPoint similar to what I used last week going through the epithelial tissue. So if you're sitting in front of your computer, you want to download this and follow along, or you can just follow along with me. This will be the PowerPoint that I'm using for that today. I recommend studying from this PowerPoint. There's a lot of really great information in this PowerPoint, not just on the identification of the tissues, but on the identification of some of the cells and some of the cellular structures that are on these PowerPoint slides. This tissue packet up here is great because this gives you a way to label the structures on the tissues that you'll hear me talk about today. And then again, utilize this repository here. This is the same tissue repository that we had linked to in the last lab right here. But definitely go in the tissue repository and look at some of the slides in the tissue repository, as well as studying the slides from the connective tissue walkthrough right here. All right, so these are the resources you want to use for this week's lab, and this is the one I'm going to primarily use today as well. All right, well then let's get started on today's lab. Today's lab doesn't have as much physiology background that we're going to kind of talk about, ahead of the identification. But we do have to talk about some of the characteristics that we see that are specific to connective tissue. When we talked about epithelial tissue, we talked about cells being packed very tightly close together. We talked about having an apical surface and a basilar surface that we associated with that epithelial tissue. And connective tissue is going to be very different from that. All right. Where with epithelial tissues, those cells had little to no extracellular space. With connective tissue, the cells are going to have extracellular space. We're going to see distance between those cells. Hang on a second, y'all. All right, sorry about that. My wife had the heater turned up, and I felt like I was in an oven roasting. So, um, and so with epithelial tissue, we saw space, or didn't see space between the cells, but with connective tissue, we will see space between the cells. With epithelial tissue, we saw an apical surface. With connective tissue, we won't see that apical surface. Epithelial tissue, like we said, was avascular. Connective tissue, for the most part, is going to be very vascular. One of the reasons why, connective tissue is going to be very vascular. One of the reasons why connective tissue is so vascular is because in a lot of instances, it has epithelial tissue attached to it. And we need to be able to have that vascularity to support not only the connective tissue itself, but to support that epithelial tissue that it's attached to. Now, there are instances where we see connective tissue that is not very vascularized. When we talk about dense regular connective tissue, which is what makes up our tendons and our ligaments, it does not have a lot of vascularity to it. And when we talk about cartilage, cartilage for the most part is going to generally be avascular. We kind of touched on that a little bit when we talked about synovial membranes last week, because we mentioned synovial fluid helping to provide nutrients to the cartilage that we find within those joint capsules. But connective tissue is basically going to be made up of three different things. One, we're going to have the cells associated with that particular connective tissue. Now, some of the cells that we have associated with connective tissue are going to be generalized cells that we see found in a lot of different types of connective tissue. And then some of the cells are going to be very specific. But we find cells, and we find what we call an extracellular matrix. Extracellular matrix is just going to be what we see around the cells. If the cells are not packed on top of each other and we have space between the cells, space doesn't necessarily equal emptiness. That space is going to be filled with something, and what it's filled with is called the extracellular matrix. Okay, extracellular meaning around the cells. That extracellular matrix is going to be made up of two things. One, it's going to be made up of different fiber types, and two, it's going to be made up of what we call a ground substance. All right. So we have cells that are going to be sporadically placed. Around those cells is going to be an extracellular matrix, and in that extracellular matrix are going to be fibers and ground substance. Now, when we talk about different types of cells associated with connective tissue, we can generally categorize them into one of two types, either fixed cells or what we call transient cells. Now, fixed cells are permanent components of a specific type of tissue, all right, meaning that we only find that cell in a particular type of tissue. Chondroblasts or chondrocytes are only going to be found in cartilage. Osteoblasts, osteocytes, osteoclasts are only going to be found in bone tissues. So that makes those cells fixed cells because we don't find them anywhere else or in any other types of tissue. When we talk about a fixed cell, we can generally have one of three different suffixes that we'll put at the end of a particular cell. Now, the beginning part of the word is what describes or tells you what type of tissue it's associated with. If you see osteo, you know it's associated with bone. If you see chondro, you know it's associated with cartilage. But what we find at the end is often going to tell you what type of cell we have. Do we have a cell that's actively trying to help build tissue? Do we have a cell that's trying to help to tear tissue down, or is it a maintenance type cell? An osteoblast is a cell that can undergo cell division. And this is going to be a cell that's going to secrete a lot of the extracellular matrix. So when we talk about an osteoblast, this is going to be a building cell, right? So a chondroblast or an osteoblast or a fibroblast, okay? These are all cells that are actively producing something for the connective tissue. Now, a site, these would be maintenance cells. These cells are just involved with maintaining the extracellular matrix. So when we talk about chondrocytes and osteocytes, those would be helping to maintain the environment without building new ground substance or tearing it down. And then a clast type cell is one that is going to recycle or remodel or reduce the extracellular matrix, like we see with osteocytes. So with those three types of cells, the one constant that we see in there is osteo, because with osteo, with bone, we're going to constantly see it changing. All right, bone is one of the most dynamic tissues in the body, so we're going to constantly see it in a state of making new bone as well as tearing down the old bone. So we have osteoblasts, which build, osteoclasts, which tear down, and then our osteocytes, which are just going to help to maintain the normal extracellular matrix around those cells. Now, transient cells. Transient cells are the cells that we can find in multiple types of connective tissue. One of the most common types of transient cells that we find is a fibroblast. And fibroblasts, we know blast is a building cell, so a fibroblast is a fiber building cell. All right. And we're going to find lots of fibers in connective tissue. Again, that's what we mostly are going to find in that extracellular matrix are different types of fibers. And depending on what types of fibers we find, that typically is going to be what dictates the functionality for that particular type of connective tissue. Connective tissue is very versatile. All right, we're going to have a lot of different functions associated with connective tissue because of the different arrangements that we're going to find with connective tissue as well. Some connective tissue will do exactly what it sounds like it does, and it will connect or it will attach things. Other connective tissue is going to provide us a frictionless surface, or it's going to provide us with structure, or it's going to provide us with transport. So it just depending on how the connective tissue is arranged and the types of fibers that we find, that's going to contribute to the overall function. Again, this idea of structure dictating function is going to be very prevalent in what we see with connective tissues. So fibroblasts, these are going to secrete fibers of different types, which we find, again, scattered through the extracellular matrix. Macrophages, a macrophage is a phagocytic cell. A phagocytic cell is a type of cell which is used to help to fight off infection or clean up debris that we have in tissues. Plasma cells. Plasma cells are going to be found in the blood. They're going to be used to help to secrete antibodies for immune response. Mast cells. Mast cells are going to be used in histamine production, which is going to be a part of our inflammatory response when we have tissue damage or some type of allergic reaction. Adipocytes are fat cells. Adipocytes are unique cells because they do grow by hypertrophy, meaning that the cells are going to get larger in size, like we talked about last week. And the adipocytes have the ability to store triglycerides. They're going to do that in an area that we call the fat vacuole. And then leukocytes, which are white blood cells. These are going to be specialized cells that are also going to play a role in immune response. Now, we have lots of other cells. We have erythrocytes, we have chondrocytes, osteocytes we talked about, we have reticulocytes. So we have a lot of other cell types. These are just some of the examples that we have of fixed and transient cells. We talked about fibers. The fibers that we find in the extracellular matrix are going to mostly be made out of protein. Now, why do we use protein as a building block when we're creating things in the body, such as fibers or muscle tissue or anything like that? Well, proteins are fairly stable molecules, meaning that they're pretty non-reactive with other molecules. They're not going to change their structure or their presentation very easily. In fact, there are very few things that are going to cause a protein to make itself into something else or bind it to something else. The only time we typically see proteins altered in some way, shape, or form is when we introduce energy into that protein, whether it be heat energy or electrical energy or chemical energy or radiation energy. Energy is really the only thing that can structurally change a protein. And if we structurally change a protein, then that means we're going to functionally change it as well, because we know of the relationship between structure and function. When we introduce energy into a protein, it undergoes a process called denaturing. The denaturation of proteins is what changes them to behave differently. We've all seen this happen. You've all seen a protein denature right there before your eyes when you crack an egg onto a hot frying pan. When you open an egg up out of its shell, you know it's a complete liquid, gelatinous blob, clear, and then we have the yellow yolk. But when we introduce heat to it, the first thing we notice is that it starts to begin to change from a liquid to a solid. The clear whites of the egg actually then turn white. The yolk, if you cook it long enough, goes from a liquid to a solid. That's because the proteins in the egg begin to go through changes. And as they change the physical properties, which we can then see by it going from a liquid state to a solid state. So when we talk about denaturation of proteins, that's the kind of thing that we're talking about. And this can happen to anything. Muscle fibers, okay, are mostly made out of proteins. When you cook muscle, like when you cook meat, you can see that go through a process and a breakdown where it physically changes the texture of the meat itself. And that's because of the denaturation of these different types of protein fibers. So what do you get out of all that? Energy is bad for proteins. Okay. Heat energy, electrical energy, radiation energy, chemical energy, all bad for proteins, which is why we see tissue damage occur so rapidly and so completely when we introduce those things to different types of tissue, because our tissues are going to have a high amount of connective tissue to them. Now, the three fiber types that we're going to see in the extracellular matrix of connective tissues are going to be collagen fibers, elastic fibers, or reticular fibers. Now, most connective tissue is going to have all three fiber types present. The amount that we have of each fiber type, the way that those fibers are arranged within the extracellular matrix, these are going to be the properties that help to decide the functionality for a particular type of connective tissue. If we have a connective tissue that's high in collagen fibers, it's going to behave more like collagen fibers. If we have a connective tissue that's high in elastic fibers, it's going to have properties highly associated with those that we find in the elastic fibers. And if it has a greater amount of reticular fibers, it's going to take on the properties of the reticular fibers. It's kind of like when you cook. If you have salt, pepper, and garlic powder, three completely different flavors, you can arrange those flavors into whatever you're cooking and make the food come out tasting completely different, depending on the amount of which ones that you put in to what you're cooking. So, we kind of get the same thing. We have these three different ingredients, these three different fiber types. How we mix them together and the way that we mix them together is then going to dictate how that connective tissue works. Collagen fibers are the most abundant of the fiber types that we have in connective tissue. And collagen fibers are typically going to be very thin fibers that are going to arrange themselves in thick bundles, which kind of makes collagen fibers work like rope. All right. If you think about a piece of rope is typically made of small fibers that are woven together to make a larger, thicker fiber, okay, like the rope itself is. And that's kind of what we see with collagen fibers. So when you picture collagen fibers and you picture how they work, think about the analogy of them being like a piece of rope. So what is rope good for? What can we use rope for? Well, we can use it to pull. We can use it to resist tension. We can use it to bind and tie things or attach things together. And those are kind of the same things that we see from a connective tissues that are going to have high amounts of collagen fibers. Now, elastic fibers are going to have elastic properties. And the properties of elasticity are the ability for something to stretch, but also the ability for it to come back to its original shape or size. Being elastic is not just about stretching. Okay. If you have a pair of socks that the elastic just stretches and it doesn't come back to its original size, you throw that pair of socks away because they're no good to you anymore. So it's not just about the stretching part, but it's about the recoil part as well. So when we talk about tissues that are going to be higher in elastic fibers, they're going to take on the elastic properties of those elastic fibers. And reticular fibers. Reticular fibers are a different type of collagen fiber. They're a specialized type of collagen fiber that are going to be branched. So, where collagen fibers bundle themselves together in a thick bundle, reticular fibers are going to branch themselves out to kind of form a scaffolding or a lattice work type arrangement. As they form this scaffolding arrangement, what the reticular fibers are going to do is they're going to give us the ability to provide structure or support to tissues. So we're going to be able to build shapes and create the stroma, which is the framework of the tissue. We're going to be able to build the stroma of particular organs. So, elastic fibers are going to be found in places that need to be able to stretch, like some of our blood vessels and our lungs. Reticular fibers are going to give shape to certain organs that are very dense and have very particular shapes, like kidneys and the spleen and lymph nodes, the liver. These are all going to be higher in reticular fibers because they're going to be higher in reticular connective tissue, which is going to have more reticular fibers. Now, the ground substance, which is going to be found around the arrangement of these fibers, the ground substance is going to help to provide uh, the the makeup for that connective tissue and give that connective tissue its essentially its physical properties and its physical characteristics. If the ground substance is liquid, then obviously we're going to have a liquid connective tissue like we have with blood. If the ground substance is calcified, we're going to have a solid extracellular matrix like we see with bone. If it can be gelatinous, it can be semi-solid, it can be plastic-like. So there's a lot of different appearances that we can see with connective tissue, and that's going to be related to the type of fibers and the arrangement of the fibers and the ground substance that's present. Hyaluronic acid, chondroitin sulfate, dermatan sulfate, keratin sulfate, plasma, hydroxyapatite. These are going to be examples of what we can find made up or making up the ground substance for these different types of connective tissues. So you should make sure that you kind of know a little bit of information about these different types of ground substances and how they contribute to their individual, which connective tissues we find them contributing to. Um, embryonic connective tissues. I don't typically spend a lot of time talking about the embryonic connective tissues. We kind of touched on mesenchyme earlier, because we know that the mesoderm is where we're going to, which is what we're going to use to give rise to connective tissues. So just make sure that you remember, when you're identifying these connective tissues, that all connective tissues are going to come from mesoderm and mesenchyme, as far as the embryonic layer. But don't worry about the Wharton's jelly, the mucus connective tissue that we find in the umbilical cord. I don't typically ask you any questions about that. All right, any questions up to this point before we start some of the identification? All right.
No.
Then let's talk and identify some connective tissues. Now, when we talk about connective tissues, we can basically break them down into three different categories. What we call connective tissue proper, which is going to be broken down into two groups called, one is called loose connective tissue, the other is dense connective tissue. The other can be broken into a supporting connective tissue, which we find is our cartilage and our bone. And then we have liquid connective tissue, which basically is our blood and our lymph. And we're going to just briefly talk about lymph when we talk about blood, but we're not going to identify lymph because there's really nothing to identify when you look at lymph. All right. And we'll kind of explain that when we get there. But we're going to go through and start with loose connective tissue. And we're going to start to identify each of the different connective tissues. Now, again, just like we did with epithelial tissue, I'm going to describe the connective tissue to you. I'm going to identify some of the cells that we find scattered through the connective tissue, just like we did identify some of the things in the epithelial tissue, like the apical surface and the basilar surface and villi and goblet cells and those types of things. So I'm going to be identifying some structures and things as we go through these as well. We're going to talk about the functions of these tissues, and we're going to talk about where we can find these different tissue types. So just like epithelial tissue, those are the things that you need to know about these individual tissues. The first group is our loose connective tissue. And in that loose connective tissue, we're going to talk about areolar connective tissue. We're going to talk about adipose tissue, and we're going to talk about reticular tissue or reticular connective tissue. Now, these three are classified as loose connective tissues because we are going to have less fibers present in the extracellular matrix. So they're not going to be very packed together with fibers like we're going to see with the dense connective tissues. So we're going to have lots more extracellular matrix or ground substance associated with these tissues. The first loose connective tissue we're going to talk about is areolar connective tissue. And areolar connective tissue is one of the most abundant and widely distributed connective tissue types in the body. Areolar connective tissue is widely distributed because it's of where it's found in its location. One of the places that we find areolar connective tissue is going to be associated with the integumentary system. We're going to find it in the hypodermis, which is going to be the layer that connects the skin to the underlying muscle. So everywhere where your skin is, where it's attached to the underlying tissue is going to be attached using areolar connective tissue. We'll also find areolar connective tissue in the basement membrane, attaching a lot of epithelial tissues to underlying tissues. So it's going to be found all over the body, and it's going to be found in a high amount because of what it's associated with, what its job is to do. And its primary job is to bind things together. All right, we're attaching epithelial tissue to underlying connective tissue. We're attaching one type of connective tissue to underlying muscle tissue. And the way that the extracellular matrix is arranged, we're going to have a lot of space between the fibers, which is going to allow for things to be able to pass through this tissue very easily, which is another reason why we use this as the basement membrane when we attach epithelial tissue, because it allows for nutrients to diffuse very easily through it. Now we're going to see mostly is going to be collagen fibers. The collagen fibers are going to be very thin looking fibers when we look on here, and they're going to make up the majority of the fibers that we see. We're also going to see fibroblasts. We're going to see macrophage cells, and we'll see some elastic fibers as well. So let's take a look at our areolar connective tissue, and I'm going to jump over to the PowerPoint so we can take a look at it. And we'll see a few different slides of areolar connective tissue, but this is the first one, and this is a great example of our areolar connective tissue. Now you can see right here, okay, these are our fibroblasts, all right? So these are our largest cells that we see right there. So those will all be fibroblasts. Right here, okay, where we have the green arrow, that's going to be our macrophage. These are more of a kind of a lima bean shape to them, all right, whereas these are a little bit longer in their shape, a little more oval-like. And then down here where the yellow arrow is, this is a mast cell, all right? And the mast cells are going to be what, again, secrete histamine for any type of allergic reaction or some type of tissue damage response. Now, scattered through here, you can see lots of different fibers, all right? These darker ones right here that are very thin, these would be elastic fibers. And the thicker ones that you can see scattered through, that the majority of these fibers are, those would be our collagen fibers. But notice how the fibers are very spread out. We don't have a lot of density to the fibers. That's what's going to allow for nutrients to be able to diffuse through this tissue type. And the fact that the fibers are running in lots of different directions gives it the ability to resist tension and be able to be pulled in lots of directions, which makes it very suited for binding two tissue types together. So this is one of our views of areolar connective tissue, and we have a few slides here associated with it. This slide here, I'm not as crazy about this slide as the previous one, but again, you can see these spindle-shaped, these long fibroblasts right here. This black arrow right there, that's pointing to our elastic fiber. You can kind of see it squiggly as it runs through there. So those would be elastic fibers. And then this yellow arrow down here is showing us another mast cell. And this one, I think this one paints a better picture as to what we see as far as the arrangement of fibers, because you can see a lot of space in between those individual fibers. Again, we can see this red arrow, not that one right there, but this red arrow pointing to a fibroblast, okay, these long kind of oval-like cells. And on this one, you can kind of see it creating the fibers as it comes off of the fibroblast. Right here, this is our macrophage. And this blue arrow, it's pointing to some of the collagen fibers that you can see woven through the extracellular matrix. So again, be sure that you can identify some of these cells. Okay, notice the lima bean shape. You can see it really clearly on this macrophage compared to the long spindle shape that we see right here, this fibroblast, because you'll probably have to identify one of those two cells on the practical itself. Now, our next type of loose connective tissue is going to be adipose tissue. And adipose tissue is going to primarily be made up of adipocytes. Adipocytes are our fat cells, and adipocytes, like we said, are unique because these are cells that grow by hypertrophy. Adipocytes are also going to be unique because they're going to look like there's a lot of empty space associated with the cell. The empty space, though, that we see is going to be the fat vacuole. That fat vacuole is going to contain the triglycerides that we use for energy stores. And that's one of the primary functions of our adipose tissue is an energy store. Our body has the ability to store carbohydrates in a very minimal capacity. We can store about 20 to 30 minutes, maybe a little longer if we, carb loaded or something like that, worth of carbohydrates. After that, our body is going to begin to convert those carbohydrates into fat. Okay, so any carbohydrates that don't get used up or don't get burned get converted for long-term storage, which is in the form of triglycerides. That's why carbohydrates get such a bad rap. Because people think, oh well, if I take in carbohydrates will make me fat because they turn into fats. They only turn into fats if you don't use them. So, if you're a jogger, or if you're somebody that exercises and does cardiovascular exercise every day, carbohydrates aren't a bad thing because your body is readily burning those carbohydrates. When our body runs out of carbohydrates, then it switches to lipid burn. And so then we'll start to burn down our fat stores. Now, if you don't have any carbohydrates, then your body will burn lipid stores first. But the problem with that is that our body doesn't burn lipid stores as quickly as it burns carbohydrates, which is kind of what people experience when they do some type of ketosis diet or something like that. For a period of time, they experience this fog that they kind of live in because they don't have the instant energy available to them because they're not taking in the proper amount of carbohydrates into their diet. Um, but that's all for a nutrition class later, at some other time. But one of the purposes of adipose tissue is that energy store. Now, adipose tissue also, though, provides us with some protection. Adipose tissue can be voluminous, and it can provide us with some padding, say around some of our vital organs. Too much adipose tissue is obviously then bad for those organs because it can put pressure on those organs and cause those organs not to function properly. But it's good to have a little bit of that padding around those individual organs. And we can also use adipose tissue for thermoregulation. We have adipose tissue in our skin, located in the hypodermis, between the exterior part of the skin and the muscle tissue, which is what gives our skin kind of its thickness and its puffiness. And that helps us to regulate body temperature loss and also prevent body temperature elevation. Just like the insulation in your house keeps the cold out and the heat in the wintertime, and keeps the heat out and the cold in the summertime. So, there's a lot of functionality for adipose tissue, even though it gets, a very bad rap and has a lot of, very negative connotation to it. Our body needs it. And it needs it in the proper amounts in order to keep all of our systems functioning properly. Too much adipose tissue loss can create some very, very detrimental and serious conditions that can put your body, at risk of shutting down and starting to consume other resources like proteins, which is what we see in starvation cases, where your body starts to break down its own materials, which is definitely a bad thing. Fat can come in two different forms, brown adipose tissue and white adipose tissue. Mostly what we see in our body is classified as white adipose tissue, but in early in life, we are going to have brown adipose tissue present. Brown adipose tissue is found in newborns, and it's used as a thermogenic fuel to actually create body heat. It's going to be higher in mitochondria. Those mitochondria are going to create ATP for the rapid cell development that we're going to see, but also they're going to generate body heat because of the lack of musculature and movement that we have associated with newborn infants. It's the same type of adipose tissue that we see in creatures like bears that are going to hibernate for long periods of time. So when they're sleeping in their cave for periods of months at a time, this is what keeps them from not freezing to death, and what keeps them alive is the fat that their body actually is going to use for fuel while they're in this hibernation process. But as we develop and as we get older, because we're not hibernating animals, our body is going to lose its brown adipose tissue, and we're, like I said, primarily going to be made out of white adipose tissue. So let's take a look at our adipocytes and our adipose tissue. Now, adipose tissue to me is one of the easier tissues to identify because adipose tissue kind of looks like pink soap bubbles. If you were to blow bubbles, this is kind of and they were all kind of connected together, this is kind of what it would look like. Now, what we see on these films or on these slides, is individual adipocytes. Okay, this is one adipocyte. That's the nucleus of the adipocyte. Okay, smashed over to the side. And why is it smashed over to the side? Because all of this area right here that we see that's clear, this is the fat vacuole. And this is going to be where the triglycerides are stored. So as we build up triglycerides in here, basically all of the cytoplasm and the nucleus gets smashed over to one side of the cell. All right. So the same thing right here. We have fat vacuole right there, nucleus smashed over to the side of the cell. All right. Fat vacuole here, nucleus smashed over to the side of the cell. All right. On this one over here, we don't see the nuclei as much. You can kind of see them smashed into the corners on some of these. But again, what this arrow is pointing to in the right on the right slide is the fat vacuole. So again, this is an adipocyte. That's the cell. All right. That's the nucleus. And then this would be the fat vacuole where the triglycerides are stored. All right. Reticular connective tissue. Now, if you have reticular connective tissue, you would expect then reticular connective tissue to be high in what type of fibers? We have three types of fibers, right? Collagen, elastic, and
Reticular.
reticular fibers. So reticular connective tissue would be high in reticular fibers, and it is. Because the purpose of reticular connective tissue is to provide some structural supporting framework for particular organs. So those organs that we mentioned before, lymph nodes, spleen, kidneys, to some extent the liver, these organs that are going to be very dense and have a very particular shape and structure to them are going to be higher in reticular connective tissue. Now, reticular connective tissue is interesting tissue because it also has the ability to form red blood cells. Reticulocytes, which we're going to see scattered through our reticular fiber. Reticulocytes are immature erythrocytes. Eventually, these reticulocytes are going to eject their nucleus, and when they do, they enter the bloodstream as red blood cells, okay, because red blood cells are anucleic, they don't have a nucleus, and while most of our generation of red blood cells is going to come from red marrow, we do see these reticulocytes eventually become red blood cells. So when we take a look at the reticular fibers, or reticular connective tissue, excuse me, we'll identify the reticulocytes, but we'll also identify all of the reticular fibers. And to me, reticular connective tissue has a very specific appearance to it. It kind of reminds me of a cherry blossom tree. If you've ever seen a cherry blossom tree, you know, it has these bright pink flowers to it. And so to me, that's what reticular connective tissue kind of looks like. Okay, you can see it particularly on this slide over here, where it looks like a cherry blossom tree. All of these little black lines that we see woven through here, those are the reticular fibers. And all of these little red dots that you see scattered through here, those are the reticulocytes. And again, those reticulocytes will become erythrocytes, which are red blood cells, later when they mature. Now, this one over here is a little harder to see, the reticulocytes. They just didn't stain as well, but you can still see the density of the reticular fibers kind of and how they branch like branches on a tree, kind of woven through this tissue. And again, think of reticular fibers kind of as 2x4s. All right, we described collagen fibers as rope, being that we could use them to resist tension and pulling and binding things and stuff like that. Reticular fibers are more like 2x4s. So they're going to build framework, just like you would use 2x4s to frame your house, to build your house, to give your house structure and shape and all of these types of things. That's kind of the way that we see reticular fibers in reticular connective tissue. Now, as you go through these, you know, I'm giving you examples of kind of what I think these look like and stuff. You know, if you see something else as you're looking at these, please write something down, okay? Because I think that's a great way for you to remember and recognize this stuff when you're taking the practical. That way, if something pops up and you go, "Oh, yeah, this Dr. B said this looked like a cherry blossom tree. Which one was cherry blossom tree? Oh, that was reticular connective tissue." So if you can use that as a reference as to, hey, it looks like something, then you know by all means do that. And if it doesn't look like it to you, if this doesn't look like, you know, a cherry blossom tree, or you've never seen a cherry blossom tree and it looks like something else, then write that down as well, because you may see something a little different than what I'm seeing, than the next person's seeing, and so forth. Now, don't make the mistake, and this is a common mistake. Don't make the mistake by mixing up reticular connective tissue and blood. All right, we're going to look at blood in just a little bit, and blood is going to have lots of red blood cells. But one of the things that blood is going to be missing is it's going to be missing all of these reticular fibers. All right, so make sure you don't get reticular connective tissue and blood mixed up. One, you're going to see fibers right here, and the other one, you're not going to see fibers, and that's going to be blood. All right, so that takes care of what we classify as our loose connective tissues. All right, and again, loose just has to do with how tightly packed together and the density that we see of the fibers themselves. So with dense connective tissue, we're going to see tissues which are going to have a lot more fibers to them. We're going to see a lot less ground substance associated with these connective tissues because of the increased amount of fibers. Now, the first one we're going to talk about is going to be dense regular connective tissue. Dense regular connective tissue, the word regular is telling us the pattern of the fibers. We're going to have dense regular and we're going to have dense irregular. With dense regular, all of the fibers are going to pretty much be running in the same direction. With dense irregular, the fibers are going to be running in lots of different directions. All right. So that's what we want to look for as far as the differences between these next two slides. With dense regular, the fibers are going to be running the same way, and dense irregular, the fibers are going to be running in lots of different directions. Now, if all the fibers, and what we're mostly going to see with these next two slides are going to be collagen fibers. If I have a bunch of collagen fibers all running in one direction, what would we see that tissue very adept at doing? Well, if I said collagen fibers were like rope, if I have a lot of rope all running in the same direction, then that rope would be very good at resisting tension in that one direction, in pulling things in one direction. And that's what we're going to see with dense regular connective tissue. The ability for this tissue to stretch against tension in one plane or in one direction. So where are we going to find this? What are we going to use this? What type of tissue we're going to use this in? Tendons and ligaments. Okay. Tendons and ligaments can be stretched in only one direction. Tendons and ligaments don't do well when we twist them like this, and they don't do well when they have shearing forces like this. But if we stretch tendons and ligaments in one direction, they're very tension resistant because of the amount of dense regular connective tissue that we have in those different structures. So let's take a look at our dense regular connective tissue. And again, we'll see collagen fiber bundles and we'll see fibroblasts, and those fibroblasts will be scattered throughout that connective tissue. So here are examples of dense regular connective tissue. All right, we've got 3 different examples. 2 of them have the fibers running vertically like this that we can see in B and C, and then A is set up so the fibers are running kind of from left to right. But you can see mostly, especially in C and B over here, all of the collagen fibers kind of woven together and how all of them are kind of moving in the same direction like that. Notice we don't see any fibers running across like this. And in this one, we don't see any fibers running across like this. Now in this one, we see the fibers headed left to right. We don't see any fibers running from top to bottom. So the ability for those fibers to run in a single direction gives it the ability to resist tension in that specific direction. Now we can see fibroblasts scattered through here. Here's one here, there's one there, there's one there, there's one there, there. Over here, we can see these fibroblasts all scattered through here, these dark stained, okay, fibroblasts scattered through here. So again, be able to identify those fibroblasts in there and then look at the directions that the fibers are running. If the fibers are all running parallel to each other or in the same direction as each other, it's dense, regular connective tissue. And again, that's going to be found in tendons and ligaments. Now, dense irregular, we said, is going to have fibers that run in lots of directions. So if dense regular was very adept to resisting tension in one direction, then irregular, because it has fibers going in lots of different planes, is going to be adept to resisting tension being pulled in lots of directions. So tissues that get pulled in lots of directions, like our skin, is going to be someplace that we find high amounts of dense irregular connective tissue. And that is the case of where we find it. We find it in the dermis of our skin. This is one of the toughest tissues in our body because it has lots of collagen fibers. Because those collagen fibers run in all kinds of directions, it's going to be able to resist a lot of stretching. However, if we provide too much force to it, that tissue will stretch and it will tear. And if we see that tearing, that will cause scarring. When we get into the integumentary system, we're going to talk way more about dense irregular connective tissue, and we'll talk about the scarring associated with excessive stretching that we see with dense irregular connective tissue. Now, this is going to be a highly vascularized tissue. It says in your lab manual that it has a steak-like appearance, and it does kind of look like steak marbled through because the fibers are running in different directions. We kind of see light passing through it, and it gives it this steak-like appearance. But let's take a look at our dense irregular connective tissue. Now, I want you to remember what this regular look like, okay, where we have all these fibers running the same direction. And now look at our dense irregular connective tissue. Some of these fibers are running this way, some of these fibers are running that way, some of them are running this way. And because those fibers are running kind of crisscross to each other, we're getting a little space between those fibers, which is what we see here in between the different fiber types. But you can see if you follow the fibers, all the different directions that these fibers are running and how they're kind of swirled together. This is going to give the ability for this tissue to be pulled in lots of directions. Now, again, you can see these dark nuclei here associated with the fibroblasts. And this is one thing I haven't brought up yet, but this is, again, one of the keys to identifying whether you're looking at connective tissue or whether you're looking at epithelial tissue. Remember, if this was epithelial tissue, would we see a cell right there and then a cell all the way over there and then a cell all the way up here and up here and up here? No, all those cells would be smashed right on top of each other. So again, you should be able to look at this tissue right off the bat and at least categorize it as connective or epithelial tissue and then go from there. Right now, if you look at it and know right off the bat, oh, that's definitely dense irregular because it looks like steak, then fantastic. All right. You remembered what it looked like and that gave you the answer, then move on. But if you don't know what it is, at least categorize it as epithelial or connective tissue and then start to break it down from there. What do I see? All right. Well, I see cells that are spaced apart. All right. I know it's connective tissue. All right. What do I see from there? Do I see reticular fibers? No, I definitely don't see adipocytes. Are all the fibers running the same direction? No, they're not. So, oh, well, this is dense irregular. So you can break it down by the characteristics that you see to help you then figure out what type of tissue it is that you're looking at.
I have a question.
Yeah.
So in picture A at the bottom, is that epithelial?
Hang on a second. Let me back here. Right down here, yes, that would be some epithelial tissue mixed in. These are probably glands that we find embedded in the dermis. But again, it will always, on the exam, you'll see mostly what you'll see is going to be in the field of view. And if there are multiple tissue types, we'll have an arrow pointing to, hey, this is the one that you want to identify. But no, that's a good catch down there to see that epithelial tissue kind of woven in there. Okay. And like I said, those are probably some sebaceous glands that we see in the dermis of the skin, which when we get to exercise 4 after the practical, we'll look at the skin kind of, we'll look at that dermis kind of at a lower magnification so that we can see all of the structures that we associate in the skin. But yes, that would be epithelial tissue down there. All right. And our last type of dense connective tissue is going to be elastic connective tissue. Now, just like reticular connective tissue is high in reticular fibers, elastic connective tissue is going to see a higher incidence of elastic fibers. These elastic fibers are going to help to prevent stretching or allow for stretching, and then also, though, return back to its normal shape and size. Now, where do we find elastic connective tissue? Well, like we said, one of the places we're going to find this is going to be in the lungs. The lungs have the ability to stretch and expand when we take a breath in, and then return back to their normal shape when we blow that breath out. So the ability for them to change shape and maintain their shape is because of a high amount of connective tissue, elastic connective tissue. The other place we're going to find this is in blood vessels, especially some of the larger blood vessels like the aorta. The aorta has the ability to stretch when the heart contracts to accommodate the pressure associated with the volume of blood that's being ejected, but then it has to be able to snap back to its original shape and size during relaxation of that heart contraction. Blood vessels that vasoconstrict and vasodilate, like arteries and arterioles, again, are going to have elastic connective tissue woven into the layers of those particular vessels. So, we have to have the ability to stretch and recoil, and that's going to come from increased amounts of elastic connective tissue. Now, we are also going to identify elastic cartilage, all right? So the key to remember on the practical is don't get those two mixed up, all right? Don't get your elastic connective tissue and your elastic cartilage confused. Now, how are you going to tell them apart? Well, elastic cartilage is going to have chondrocytes. Okay, it's going to have the cells associated with cartilaginous tissue, which I'm going to show you, and you're going to be able to identify very easily. So if you see chondrocytes and you see elastic fibers, it's elastic cartilage. If you see elastic fibers but no chondrocytes, it's elastic connective tissue. And make sure you put elastic connective tissue or elastic cartilage. If you just put elastic as an answer, if I say, what is this tissue? And you just put elastic, then it's going to get marked wrong, because I don't know if you're talking about elastic connective tissue or if you're talking about elastic cartilage. So make sure you differentiate between the two. All right, so let's take a look at our elastic connective tissue. Now, to me, elastic connective tissue kind of looks like bacon. All right, like these woven bacon, or kind of like beef jerky, maybe, where it's kind of this wavy appearance. The dark elastic fibers, okay, are these that are woven through some of our collagen fibers. Now, we do have collagen fibers present. Okay, we said we had all four tissue types or all three fiber types present, but you can see the increased number of these black wavy elastic fibers, which are going to give this tissue more of an elastic presentation. That gives it the ability for them to stretch, and then when they relax, like they're in this state here, they recoil, and which gives them this squiggly-like appearance. If this was stretched out, then they wouldn't have this wavy-like appearance because they would all be at their maximum stretch. But those are the elastic fibers, okay? And this is elastic connective tissue. All right, no chondrocytes we see here. All right, again, chondrocytes will be easy to recognize, so it'll help you distinguish between elastic connective tissue and elastic cartilage. All right, any questions on the dense connective tissues? All right, then. So the next thing we're going to get into is our supporting connective tissues. And the first group of supporting connective tissues we're going to talk about is cartilage. Now, cartilage is easily recognizable, in my opinion, because of the chondrocytes that are present within cartilage. These chondrocytes and chondroblasts, these individual cells unique to cartilage, make cartilage very identifiable. So if you look at something and you see a chondrocyte or a chondroblast present, then it's one of the three types of cartilage. So again, that's one of those identifying characteristics that should be easy to see, that should eliminate the majority of your choices and narrow it down as to one of the three cartilage types. Now, hyaline cartilage is going to be the most abundant type of cartilage we have in the body, but it's also going to be the weakest of the three. The reason it's the weakest of the three is because it has the fewest number of fibers in the extracellular matrix. Now, the ground substance that we associate with cartilage is going to be chondroitin sulfate. That chondroitin sulfate is going to form an almost like plastic-like appearance to the cartilage, particularly in hyaline cartilage. and which is why hyaline cartilage is going to be very wear resistant. Right? Think of hyaline cartilage like bone light. Right? Think about cartilage like being plastic compared to bone as being steel. Right? Bone is very firm. It's very structurally stable. It's going to be very supportive. We can build shapes out of it. Cartilage, we can build shapes out of, and it's going to be somewhat supportive, but it's also going to have some flexibility to it. Kind of like I said, like comparing plastic to steel. Cartilage is going to be avascular, which is good because where we find cartilage in some of these instances, we want it to be avascular because with a lack of vascularity, we also have a lack of nervous innervation to these tissues, so they don't give us the ability to feel a lot of things with cartilage. And hyaline cartilage is going to be one of those tissue types. Where we find hyaline cartilage is going to be on the ends of long bones. So hyaline cartilage creates this smooth, plasticky surface on the ends of bones for the bones to be able to move back and forth against each other. As those bones move back and forth against each other, they're going to create friction, and we want to limit the amount of friction associated with that movement. So we have hyaline cartilage put in place. Now we're also going to have in the joint capsule synovial fluid, which is going to help to reduce friction. But the hyaline cartilage gives us a smooth surface for which those bones to move back and forth against each other. Now, hyaline cartilage is going to be surrounded by a perichondrium. That perichondrium is vascular, which is going to help us to grow the new cartilage when we're making the cartilage to begin with. But eventually, that cartilage is going to slow down in its production, and the chondroblasts that we see will become chondrocytes. At which point, cartilage has very limited capability of regeneration or repair. Which is why oftentimes if we damage cartilage, particularly hyaline cartilage, there's no way of fixing it. If you damage cartilage in a joint, oftentimes they just go in and remove the cartilage that has broken off because sewing it back together is not going to promote growth because of its avascularity. So we're going to take a look at some hyaline cartilage here, and we'll identify some of the structures that we see. But again, cartilage is going to be based on the presence of chondrocytes. And when I look at cartilage, no matter what kind of cartilage I'm looking at, cartilage chondrocytes kind of look like googly eyes. All right. I know that's not a very scientific term, but if you look at these, you can see how these chondrocytes and chondroblasts are kind of paired together oftentimes. And so they kind of look to me like googly eyes. So anytime you see these googly eyes staring back at you, you know it's some type of cartilage. The next thing you want to do is look at the ground substance, look at the area around it in the extracellular matrix. Do we see lots of fibers in that extracellular matrix? No, I don't see hardly any fibers in this extracellular matrix. So that tells me that it's hyaline cartilage. Now, this hyaline cartilage right here where this yellow arrow is, that would be the perichondrium, okay, which is dense, irregular connective tissue on the surface of the cartilage where we're going to grow new cartilage. Up here, it would be right there, all right? The red area is a space called the lacunae. That's where this googly eye is, which is where our chondrocytes were, all right? But again, that's going to help you in the identification of this being some type of cartilage. Now, again, hyaline cartilage is the weakest type of cartilage because it has very few fibers in the extracellular matrix, but it gives it the most flexibility. You'll learn, and kind of as we go through this semester, there's a relationship between stability and mobility that is inversely proportional, meaning that as something becomes more stable, you can move it less. As something moves more, it becomes less stable. We get more flexibility with this type of cartilage, but because of that, we get less stability, okay? We get less wear resistance. If we want to have more wear resistance, if we want to create a more stable tissue type, we have to increase the density of the extracellular matrix, which means we're going to need more fibers in here. So that is when we get to elastic cartilage. Okay. And look, on the practical, you don't have to say elastic cartilage connective tissue. If you just say elastic cartilage, that's going to be fine. Elastic cartilage connective tissue is a lot to write in one space. So what are we going to see with elastic cartilage? Well, we're going to see chondrocytes present again, and that's going to help us to identify this as a cartilage. But we're also going to see increased numbers of elastic fibers. So those very dense black fibers that we saw in elastic connective tissue, we're going to see those fibers woven into the extracellular matrix of our elastic cartilage. So again, fiber identification, chondrocyte presence, that's what's going to give us, excuse me, our elastic cartilage here. You can see how we have those fibers woven into the extracellular matrix. First of all, we see our chondrocytes, all right? We see our googly eyes, all right? So that lets us know that we have a type of cartilage. But then we're also going to see these fibers, these black fibers interwoven, and that tells us it's elastic cartilage. Now, I don't typically go by how these stain and what colors these stain, but oftentimes elastic cartilage is going to have this kind of purplish hue to it. So that can kind of help you distinguish between elastic cartilage as well. And our last type of cartilage, which is our, oh, where do we find elastic cartilage? Well, the most obvious place we find elastic cartilage is in the external ear, all right? That's what gives your ears, your external ears, the ability to change shape or fold up and then return back to their original shape. That's elastic cartilage specifically in your ears. We also find it in the epiglottis, and the epiglottis is going to be a little flap that covers down over the trachea, so that when we swallow food, our food gets directed into the esophagus and not into the respiratory tract. That's also going to be a place where we have elastic cartilage present. And our last type of cartilage is fibrocartilage. And fibrocartilage is going to have more fibers than we saw in hyaline cartilage. Think of it as hyaline cartilage's bigger, stronger brother, all right? Where hyaline cartilage has a little more flexibility, fibrocartilage is going to have more wearability. So we're going to have fibrocartilage in areas of high stress and high load. So places like the intervertebral discs, all right? The discs, excuse me, in the spine are going to be made up of fibrocartilage. Why? We have a tremendous amount of stress and strain in the spinal column, and we need something that's going to be very wear resistant to all of that stress and strain that we put on the spinal column through the entirety of the day. In the knees, we're also going to find menisci, all right? The menisci in the knees is going to be made up of fibrocartilage. Now, in the knees, we also have hyaline cartilage. Our hyaline cartilage is going to cover the ends of the long bones, but the menisci are going to help to prevent wear resistance in the knee joints as well. So let's take a look at our fibrocartilage. And with fibrocartilage, again, we're going to see chondrocytes present, although we don't typically see as many chondrocytes as we saw with hyaline and elastic cartilage. But you can see that kind of googly eye presence as those paired chondrocytes there. But notice the extracellular matrix. Notice the high density of these fibers that we find in the extracellular matrix. That's what's going to make this fiber or this cartilage so resistant to wear and tear. All right. Bone. Now, to me, compact bone is one of the more easy connective tissues to identify because compact bone honestly looks exactly like a tree stump. The reason compact bone is going to look like a tree stump is because it's made up of rings of bone that we call lamellae. These rings of bone are going to help to provide structural support and integrity, and they're going to create structures that we call osteons. Those osteons are going to be what gives us the formation or that we see in the pattern of compact bone, where it looks like rings of a tree that's been cut in half or a tree branch or something like that. We're just going to identify compact bone. We're not going to look at spongy bone just yet. We'll look at some spongy bone when we get to the skeletal system. And we'll talk more about where we find compact bone versus spongy bone. Compact bone, though, is going to be found on the exterior surface of all of our bones. All right, that's the one place we can guarantee that we always find compact bone is on the external surface. Now, we're also going to find compact bone, though, making up the diaphysis of the long bones. And the diaphysis is the shaft of the long bones because those long bones are weight bearing, and we need to have something like compact bone, which is going to be very supportive in nature. That compact bone, like we said, is going to be made up of structures called osteons. Those osteons in the middle of them will have a central canal. So I will show you an osteon on the slide, and I will show you the central canal in the middle of that osteon. The osteon or the compact bone itself is going to have bone cells called osteocytes, and those osteocytes are going to be layered in between layers of lamellae. All right, so we will identify these different things when we take a look at our compact bone. And when we get into the skeletal system, like I said, we'll get into identifying a lot more structures like the canaliculi and things like that. All right, because that's kind of hard to see on the histology slide, in my opinion. So let's take a look at our compact bone. And here is our compact bone. Now, this is obviously at a much lower magnification, and this is at a much higher magnification. On this magnification, though, you can really see the individual rings that we have wrapped around this opening here. This opening is our central canal. So on this lower magnification, you can see this, a central canal. There's a central canal, all right? Here's a central canal. Here's a central canal right here. Here's one that we see cut, running between two osteons. All right, those are central canals. On this more highly magnified version over here, we can see right here where this yellow arrow is, that would be the lacunae, and that's going to be the space where the osteocyte resides. Okay, so our bone cells are going to live in these little dark spaces right here that we find woven between these rings of bone that wrap around the central canal. Now, the blue arrow right here is pointing to our canaliculi that are run between here. But again, I'm not going to ask you about the canaliculi on this because it's a little bit hard to point those out directly. We'll do canaliculi when we get to the bone or skeletal system itself. All right, and that takes us to our liquid connective tissue, which is blood. Now, blood to me is a great example of connective tissue because we have lots of cells, and these cells are going to have lots of space between them. Now, the extracellular space between them is going to be, like we said, it's going to be a fluid in this case, which allows blood to be characterized as a connective tissue that we use for transport. Transport of oxygen, transport of nutrients, transport of waste products, hormones, carbon dioxide, anything that we want to move from point A to point B is going to be done so using the liquid extracellular matrix of the blood and the cells within the blood. The extracellular matrix of the blood is referred to as blood plasma. All right. The plasma is mostly going to be made out of water, but the plasma is going to contain small amounts of fibers that we can't see woven into the plasma. All right. Those fibers are going to contribute to things like blood clotting. And when we get into ANP2, we'll talk much more extensively about blood, and you'll understand how those fibers contribute to blood clotting. The three types of cells that we find associated with blood are erythrocytes, which are red blood cells, leukocytes, which are our white blood cells, and thrombocytes, which are our platelets. Now, the erythrocytes are going to be the most plentiful cell type that we find on this slide. All right, we're going to see more red blood cells than we see with anything else. And red blood cells are easy to identify because they don't have a nucleus. Leukocytes, or white blood cells, are going to be fewer on the slide, but they're going to have very darkly stained nuclei. And the nuclei can be different shapes depending on what type of leukocyte it is that show up on the slide. There are 5 different kinds, which again, you'll identify in AMP2. And then thrombocytes, or platelets, are going to look like tiny little flecks that are scattered between the red blood cells and the white blood cells. All right. And those platelets, again, are going to help to contribute to blood clotting. So let's take a look at our blood. And again, remember, don't get blood mixed up with reticular connective tissue. All right. I know reticular connective tissue has lots of reticulocytes, which then turn into red blood cells, but it also has reticular fibers that are woven between them. Notice on this, we see no fibers, okay? No fibers in the blood plasma tells us this is blood and not reticular connective tissue. Now, again, the majority of what we see are red blood cells, all right? You'll see how they have no nucleus. You can kind of see right through the middle of them. That's because of the shape of the red blood cells being in this biconcave appearance. You'll see some white blood cells, which are leukocytes. Okay, there's one there, one there, one there. And then you'll see scattered through here these tiny little purple, they look like little purple dots. Those little flecks that you can see through there, those little flecks are the platelets. All right. So again, be able to identify thrombocytes, leukocytes, and erythrocytes. All right. Don't just put red blood cells, white blood cells, platelets. Thrombocytes, leukocytes, erythrocytes on this this slide of blood connective tissue. And again, you don't have to put blood connective tissue. If you just put blood, that'll be fine. Last week, I talked about the mucous membrane model that I told you not to worry about. This is it. Okay, so don't worry about this. We're going to identify this when we get to AMP2. I typically don't test on this for this exam, so don't worry about that. All right. So any questions on any of the connective tissues that we identified today?
On the blood slide, will the leukocytes always stain blue?
Yes, the leukocytes are always, you're going to see that dark colored nucleus stained in there. Like I said, you'll see different shapes to the nuclei. Sometimes it'll just be a solid nucleus. Sometimes it'll be a horseshoe shape like we see here. Sometimes you may see different numbers of lobes kind of to the nucleus. But yes, these will always be the staining properties of the white blood cells. And again, it's just because they have a nucleus. These red blood cells, again, they don't have a nucleus, which is why they're just going to show up as, you know, little red donut looking structures that we see scattered through the plasma. But yeah, the leukocytes will always stain like that. In fact, I'm gonna go into, before we finish today, I'm gonna go into the to the repository, and I'm going to find a few other examples that I think are good examples of these tissues that, you know, if I was going to study from the repository, I would take a look at those as well. So we'll look at a few other examples.
Thank you.
Any other questions before we move to that repository and look at some examples? All right, well then let's jump over there. Let's see some examples of connective tissues that we looked at today. All right. So again, you have lots of examples of epithelial tissue that we looked at last week. Some examples, some good examples of some of the connective tissues that we looked at this week. Let's see. Here's a great example of elastic connective tissue. All right, right here. You can see how those elastic fibers are woven in between. Now, again, don't get elastic connective tissue. Also, don't get it confused with reticular connective tissue. they look a little bit alike, but if you look at elastic connective tissue under high enough fiber, a high enough power, you just see the fibers and we don't see any reticulocytes present. This is a great example of fibrocartilage here. This is a great example of bone, compact bone. Hyaline cartilage. Again, how can we tell this is hyaline cartilage versus elastic cartilage? Well, notice with this hyaline cartilage, we don't see what? We don't see any fibers between those chondrocytes, right? We see a nice, smooth extracellular matrix as opposed to elastic cartilage where we see those dark elastic fibers between those chondrocytes. So that tells me this is elastic cartilage. Here's another elastic connective tissue. Again, easy to see those elastic fibers. Areolar connective tissue, okay, that we looked at first. Again, you can see, let's zoom in on this a little bit. You can see all of the fibroblasts. This is a little bit cloudy, so you can't really see the difference, or it's hard to tell the difference between the fibroblasts and the other cell types like macrophages and stuff. Dense connective tissue, dense regular connective tissue, all the fibers running in the same direction right here. Right here, dense regular connective tissue. Again, all the fibers running in the same direction right here. Another of compact bone, another of hyaline cartilage. Again, you don't see any fibers woven between those individual osteocytes. So that tells us that's hyaline cartilage. Some of this stuff we'll see next, or when we do the integumentary system before. Here's, this is sudoriferous glands. These are the glands that we saw on that dense irregular connective tissue. I don't remember who it was that pointed out and asked if that was epithelial tissue at the bottom. This is kind of what we were seeing at the bottom down here, some of these sudoriferous sweat glands and sebaceous glands. That one's okay of adipose tissue. I like the ones that we looked at better. Oh, here's a good one. I think this is a nice picture of areolar connective tissue. Again, you can kind of see the different cell types in here. This would be a fibroblast. It's long, skinny like this. This would be a macrophage over here. Here's a mast cell, all right? You can see, like I said, lots of elastic fibers, the darker stained, and then the lighter stained collagen fibers then behind it. Dense regular, again, fiber types all running the same direction. Elastic cartilage, like I said, has that purplish hue to it, and you can see the fibers woven in between the chondrocytes. This is a great picture of dense irregular connective tissue. Now we can see some epithelial tissue up here, all right? This is our stratified squamous right there. But down here, this is a really good slide of some dense irregular connective tissue showing you the fibers and how they run in lots of different directions. Great fibrocartilage slide. Here's another slide on blood. So you were asking about the nuclei on the white blood cells. Okay, so we can see leukocytes right there where we can see the nucleus, but you'll notice the shape of the nuclei are different on this one compared to the other one. You can see all the little flecks of our thrombocytes and then plenty of erythrocytes. So again, I would just go through, pick out some different examples of these connective tissues, the better slides. You know, we try not to use bad slides. Like I'm not crazy about this slide here just because it's so faded. So I wouldn't use something like that on the exam, but you know, you can go through. Some of this stuff is getting into what we're going to see with the next labs, the further we go down. So hopefully that gives y'all some ideas as to what you'll see, because these, again, these are the same types of pictures that you could see on the practical. All right. All right. Any questions over today's material?